Hello friends, we are here to discuss today about sleep apnea. My talk today is on a role of surgery in the retropalatal obstruction. I am a sleep specialist and I deal with children having sleep obstruction and adults having sleep obstruction. Allow me to start with the pediatric or a children having a sleep obstruction. For those whose retropalatal space has become narrow. So what is this retropalatal space? This is a space which is behind the palate, and in children it could be because of craniofacial abnormalities, it could be because of the adenoids. What we do for this kind of patient is we do what is called as RME, that is a rapid maxillary expansion, which can be done in an office-based setting, or we do something called as DOME, DOME, which stands for distraction osteogenesis maxillary expansion, which is done in the operation theatre. Doing that procedure in combination with mandibular advancement devices, oral appliances such as mandibular advancement devices or tongue return devices, we can take care of retropalatal space. This is going to increase not only the palate's length anteroposteriorly but also laterally, and this is going to also push the palate forwards, thus increasing the space. This is about the pediatric. Let's talk about the adult. Adult may have uncorrected maxillary or mandibular hypoplasia, retrognathia, which can be corrected by maxillomandibular advancement, and this is also going to increase the palatal space. But for those who don't have this, we are going to do what is called as a DICE, drug-induced sedation endoscopy. C for the palatal obstruction. Is it anteroposterior, that is forward behind, or it is side to side lateral? Depending on the obstruction, what we do is we will do anterior pharyngoplasty or anterior palatoplasty, which is very simple to do. This is going to increase anteroposterior dimension, where we also remove part of uvula, or we maintain uvula in certain ethnic populations where it is used. At the same time, if the patient has got a lateral obstruction, we do a expansion sphincter pharyngoplasty, BARP repositioning pharyngoplasty, UPPP, which are all the modifications of UPPP, is that what we do, and this is going to pull the palate laterally and anteriorly, going to increase the retropalatal space. I would like to also add a role of adenoidectomy. Adenoidectomy can be done for this patient, and this is also going to increase a retronasal and hence a retropalatal space. So this all procedures can be taken care of. There is a very eminent role of surgery. Now again, this all I would limit. So those patients who have got a BMI of 30-35, something beyond 35, you will end up requiring a bariatric surgery and an upper airway surgery in combination, and that's how it's going to give a relief. To know more about that, please do visit my website. By the way, I'm Dr. Snehal Shah. I'm a head and neck surgeon, I'm a robotic surgeon, and I also am a sleep specialist. Thank you so much.